Welcome. You've arrived at another quiet chapter of Insurance ASMR Bedtime Stories by Core Insurance Services. A gentle place to learn how protection works without pressure, fear, or rush. If you enjoy these calming stories, feel free to like and subscribe so you'll always know when a new one arrives. Take a gentle breath in and a slow breath out. Let's begin. More than 65 million Americans receive Medicare benefits right now. For many people, Medicare feels like something that has always existed, a normal part of getting older. But there was a time when aging meant losing access to affordable care. To understand why Medicare matters, we look gently back to the world before it existed. Not very long ago, older adults were often left without help when their bodies began to need more care. Private insurance companies refused to cover seniors because they were considered, quote, too risky, end quote. Hospitals could turn patients away if they could not afford treatment. Families emptied savings trying to keep their patients healthy. People who had worked their entire lives could end up facing illness alone. It became clear that something compassionate needed to change. In 1965, President Lyndon B. Johnson signed the Medicare bill into law. Former President Harry S. Truman sat beside him because he had long believed older adults deserved access to medical care without fear of cost. There were loud voices of support and loud voices of doubt, but ultimately, the nation chose compassion. On July 30th, 1965, Medicare became a promise that aging would not mean being left behind. Today, Medicare is made up of different parts that work together to help support healthcare needs. Part A, hospital care. This covers care received when someone is admitted to a hospital, the room, the staff, the services that make healing possible. Part B, doctor and outpatient care. This helps with doctor visits, testing, treatments, and other outpatient services needed to stay well. Together, parts A and B are known as Original Medicare. Original Medicare usually covers about 80% of approved medical costs. The remaining 20% is the responsibility of the person receiving care. For even simple services, that 20% can add up quickly. This is why additional coverage was created. These plans bundle your hospital and medical benefits into one plan through private insurance companies. Some include added features like dental, vision, hearing aids, or help with transportation to medical appointments. Part D helps cover medications so that important prescriptions remain accessible and affordable. Supplemental insurance, often called Medigap, works with Original Medicare to help pay the portion that A and B do not fully cover. It can help protect against large, unexpected bills. There are certain times when people can begin or change Medicare coverage. Most people enroll around their 65th birthday, though some qualify earlier because of a disability or long-term medical condition. These enrollment windows exist to make sure everyone has a fair chance to find the right coverage. Some plans are designed specifically for people who live with chronic illnesses or disabilities, helping them receive coordinated care that supports their unique needs. Some individuals receive both Medicare and Medicaid. When both programs support the same person, more cost can be covered and access to care can be easier. This is often referred to as Medi-Medi or dual eligible support. There is also a program that helps people remain at home while receiving extra daily assistance. It's called PACE, the Program of All-Inclusive Care for the Elderly. This program may offer help with meals and bathing, transportation to a nearby care center, and access to a full team of doctors, nurses, and specialists. Support can grow gently, matching the person's needs while allowing independence to remain. For people with limited income and resources, there is something called extra help or the low income subsidy. It can greatly reduce the cost of Part D medications so that medicine remains within reach. Our health needs change over time. The doctors we choose may change. The prescriptions we depend on may change. Medicare plans change too, sometimes improving or adjusting their coverage or their networks. This is why people often review their Medicare plan each year to make sure it still supports the life and care they need. Medicare has many pieces, and each of them can change from year to year. There are people, like myself, who study these rules carefully, who take ongoing training to stay approved and certified to help with Medicare. Licensed and certified agents can explain plan differences, help uncover benefits someone may not know they qualify for, and support them throughout enrollment at no additional cost. Having a knowledgeable guide can turn a confusing process into a calm, confident decision, especially when health needs evolve and choices feel overwhelming. You never have to do this alone. You can speak directly with Medicare anytime you have questions by calling 1-800-MEDICARE or 1-800-633-4227. They are available day and night to help answer questions about your coverage. There is also CMS, the Centers for Medicare and Medicaid Services, the organization that maintains these programs. Their website, medicare.gov, has helpful tools where you can compare plans, find covered services, and learn about cost in your area. No matter which path you choose, support is always available. If someone waits too long to enroll in a plan that helps cover medication or the remaining cost of Part A and B, they may pay a penalty each month for as long as they have Medicare. Planning early helps keep coverage affordable later. Medicare is a federal program available in every state. Medicaid is state-based and supports income-related needs that can look different depending on where someone lives. Sometimes Medicare and Medicaid work beautifully together to support the same person. Medicare adapts as healthcare changes. Promises that protect millions of people don't simply go away, they evolve. Medicare isn't only there for moments when something is wrong. It also supports care that helps keep us well. There are preventative services designed to catch concerns early, like screenings for cancer, heart conditions, and diabetes, along with yearly wellness visits to check in on changes in health and lifestyle. These quiet moments of prevention can make a big difference in protecting well-being as the years unfold. More recently, Medicare has expanded access to telehealth services, allowing people to speak with doctors and specialists through video visits. Especially helpful for those who have difficulty traveling or prefer the comfort of receiving care from home. care can now come to you in a new way that still feels personal and safe. Medicare also gives people the right to ask questions and request reviews of decisions that don't feel right. This is called an appeal, a reminder that each person's needs and care truly matter. You are never required to simply accept a no when your health is involved. Support exists to help people understand their coverage and find the path that leads them to the care they deserve. Many older adults are cared for by family or close friends who help with appointments, medicine, and daily routines. Medicare offers resources and guidance to support caregivers too, because caring for someone is an act of love, but it shouldn't feel like a journey taken alone. Today, many people reach age 65 with peace of mind. They can focus on healing, on family, on living, without fear that illness could take everything away. Medicare is more than a policy. It is a reminder that care is something we can build when we choose compassion.
If this episode of Insurance ASMR, Bedtime Stories by Core Insurance Services, brought you a little peace, and you'd like to hear more, there's a whole playlist of stories much like this one. Subscribe for more gentle chapters and to be informed when new stories are added. Thank you.